Xanthines. They actually say that it's based on coffee or caffeine. That's why this is my favorite medication. No, just kidding. Xanthine is a mechanism of action, so it blocks the enzymatic breakdown of CAMP or CAMP. So the increase in CAMP will cause some smooth muscle relaxation and decrease in mediators of inflammation. So the main therapeutic effect of xanthine is bronchodilation. Indications most commonly used in mild asthma and as an adjunct therapy in COPD. Adjunct meaning it's used in combination with other medication, but it's never really a standalone medication for COPD. Some precautions, definitely, if you can remember caffeine, what does caffeine do to you? So precautions would be cardiovascular disease. Some contraindications include peptic ulcer disease because it can exacerbate peptic ulcer, just like coffee, right? And also hyperthyroidism. So, thyroid hormone controlled by the pituitary gland, which regulates metabolism of the cells. So, then it exacerbates some side effects of the thyroid hormone, especially if somebody is on thyroid medication. So, it can cause some rapid heart rate, agitation, anxiety, and tremors. Common side effects, based on what we already know, it can cause some tachycardia, palpitations, and this medication has a lot of drug interactions, and so a lot of the times providers try to avoid this medication. In addition, it can also cause some headaches. So for our nursing actions, we want to monitor for therapeutic and side effects. So this is a control of medication. So control of meaning it's not a rescue medication. So this is not a medication a patient would take if they're having an acute exacerbation of asthma or COPD or any of that sort. So not for acute attacks. And again, this medication is caffeine based. We also need to monitor the drug levels of this medication. So for theophylline, the drug range would be 10 to 20 micrograms per ml. That's the therapeutic drug level of theophylline. Examples of this medication is the aminophylline and then the Theodore or Theophylline. So the only one that you need to know for this class would be Theophylline or Theodore.